Hypertensive retinopathy associated with preeclampsia. Pregnancy can affect the visual pathways from the anterior segment to the visual cortex. Posterior segment complications include worsening of diabetic retinopathy and development of central serious coronary retinopathy, hypertensive retinopathy, retinal vascular occlusion, and retinal complication of preeclampsia syndrome.
Tension. Damage is due to thickening, bulging, or leaking of the retinal blood vessels. Initially, hypertensive retinopathy is not accompanied with visual symptoms. However, as disease progresses, headaches are common, and gradual loss of vision occurs when macula, central part of the retina, is affected. Hypertensive retinopathy is best managed by keeping hypertension under control.
Application in medicine. Case presentation. An optometrist called our practice regarding a 63 years old pregnant woman who had blurry vision in blue eyes for 3 days. We requested that the patient come to our office immediately. The patient stated that she was 20 weeks pregnant, had delivered 3 children without any previous pregnancy-related complications, and had not received prenatal care during this pregnancy. We diagnosed the patient with presumed preeclampsia and suggested that she take an ambulance to the maternity hospital nearby. Soon after, she presented to the emergency room. The patient developed convulsions and required immediate airway stabilization. Subsequently, the patient underwent emerging cesarean section to deliver the baby. It was discovered that the patient was actually 33 weeks pregnant.
Blood pressure is equal to the cardiac output, the volume of blood pumped out of the heart per minute, multiplied by the arteriolar resistance. Blood flow depends on the rate of heartbeats and the volume of blood pumped out with each beat. If rate or volume increases, blood pressure goes up. Likewise, increased resistance raises blood pressure, as when arteries downstream from the heart constrict. Over time, high blood pressure or hypertension damages many organs. First, the heart works harder to pump out more blood or against higher resistance. The heart then requires more oxygen and is more susceptible to angina or a heart attack. Second, arteries and arterioles can be damaged. Arterial sclerosis results when blood moves through the vessels at high pressure, damaging the protective cells lining the vessel. White blood cells are drawn to the damaged area and form plaque. Third, kidneys can be damaged. The capillaries of the kidney are delicate. Continually subjected to high blood pressure, they break down, becoming permeable to proteins and other molecules. The kidney's tubules can become clogged, decreasing the kidney's ability to make urine. Also, the proteins injure the capillary's membranes, causing more damage and worsening the situation. Fourth, the retina of the eye can be injured if its delicate capillaries are damaged. Localized hemorrhages can occur, causing scarring and formation of new, more fragile capillaries to replace the old ones. Finally, the blood vessels of the brain can be injured. High blood pressure can cause clots to break off from atherosclerotic plaques, blocking blood flow to the rest of the brain. This is called a thrombotic stroke. Continual exposure to high blood pressure may also cause a blood vessel to burst, leading to a hemorrhagic stroke.
Pros and cons. A follow-up examination was performed 3 days after admission and delivery while the patient was sedated in the intensive care unit. Conscious sedation precludes testing of visual acuity. Indirected ophthalmoscopy disclosed resolution of the bilateral serious retinal detachment. Bilateral macular edema was still present. The patient was discharged from the hospital several days later and returned to our office for follow-up 3 weeks after delivery. At this time, visually acute with correction was 20/20 in each eye. Anterior segment findings were unremarkable.
Analysing it, the vessels seem nasalized. This to some people suggests glaucoma, but doesn't usually. There's a disc hemorrhage which suggests low pressure glaucoma or normal tension glaucoma. If you look at the veins here, they seem kinked towards each other as though something's missing. That's highly suggestive of neural loss, and that is also backed up by a PPA beta here, which is due to atrophy of the retinal pigment layer. There's a subtle notch here, so instead of being regular, it sort of kinks up a little bit. That again is an extra risk factor for glaucoma. If you look at the veins and arteries down here, that vein there is away from the neural rim, and also there seems to be loss here, so these sort of stick out a little bit, if you can see that. I've drawn the disc now, and there's all the different dimensions and labels. This is so important because it's a form of audit, and it's from this that we will make the diagnosis.
Disease. Clinical pearl. This case illustrated the importance of being vigilant about the rare and serious condition. They may occur in pregnant women with visual complaints.
A complete eye exam not only looks at vision problems, but any underlying health issues that might be first detected in the eye, like high cholesterol or high blood pressure. Schedule a pregnant test today at www.eyespot.com.
Thank you. Dami ya. Yeah, I separating the file.